Welcome to the Healthy, Wealthy, and Smart podcast. Each week, we interview the best and brightest in physical therapy, wellness, and entrepreneurship. We give you cutting-edge information you need to live your best life, healthy, wealthy, and smart. The information in this podcast is for entertainment purposes only and should not be used as personalized medical advice. And now, here's your host, Dr. Karen Litzy.
Hey everybody, welcome back to the podcast. I am your host, Karen Litzy, and today's episode is brought to you by Net Health. So Net Health wants to talk about patients and their outcomes, specifically how great it is when your whole practice is rallied around a solid outcomes management program. So they have teamed up by PHOTO, which is Focus on Therapeutic Outcomes, for the Clinical Outcomes Summit, happening from October 23rd to the 25th in Knoxville, Tennessee. Like I said, it's hosted by PHOTO, but it's not just for PHOTO clients. It's a gathering of everyone who believes in the power of outcomes management to drive change for patients, clinicians, practices, and payers. And there will also be motivating and inspiring keynote speakers, including my friend Michelle Cawley from Performance PT and Daniel Lord from Crossover Health. Healthy, Wealthy, and Smart podcast listeners get a steep discount. Use the discount code LITZY, that's Litzy. The full summit pass is only $150. Go to www.outcomesnerd.com to register. Now, on to today's episode. I am joined today by Dr. Brenda Walding. She is a women's holistic wellness expert and coach, doctor of physical therapy, functional diagnostic nutrition practitioner, and HeartMath certified coach. Brenda specializes in supporting women's health and wellness professionals in overcoming burnout and health challenges in order to truly thrive and give their gifts to the world. She currently resides outside of Texas on the beautiful Lake Travis with her husband and dog. She loves spending time in nature, connecting with her family and friends, dancing, facilitating women's circles, and learning more about holistic wellness. So in this episode, we talk about Brenda's incredible story of illness and recovery, the 9 essentials to wholehearted healing, the importance of the biopsychosocial model in healthcare, and so much more. And for all of the listeners, Dr. Walding has a free gift. So if you go to podcast.healthywealthysmart.com, click on the link to today's episode, she is offering a complimentary 45-minute consult for any woman dealing with burnout or health challenges that has a deep desire to thrive. You can schedule your consult and see how she may be able to support you in creating a life you love. So this is very exciting. I want to thank Dr. Walding for offering this free gift to everyone. So I would take advantage of it. Again, you can find it by going to podcast.healthywealthysmart.com and clicking on the show notes for today's episode. Thanks, everyone. Enjoy. Hey, Brenda, welcome to the podcast. I'm happy to have you on.
Thank you so much for having me, Karen. I'm excited to be here today.
You are a recently published author of the book Sick of Being Sick, The Women's Holistic Guide to Conquering Chronic Illness. So without giving away the entire book, can you give the listeners a little bit more about your background and your story of illness and where you are and how that led you to where you are today?
Yeah, sure. I'd love to. It's really I'll give you do my best to give you the cliff notes. It spans the time period of over a decade. So really, I grew up seemingly really healthy and vibrant. I was a collegiate athlete. I played soccer at TCU in Fort Worth, and then I went on to physical therapy school to get my doctorate in physical therapy. And then after that, moved to Austin, Texas with my now husband. And during that time, we, passed our licensure exam, got new jobs, moved to a new city, got engaged, got married. And then after this whirlwind of all these major life events, my health started to rapidly decline. And, I was in a busy physical therapy practice and seeing a lot of patients. And, all of a sudden I was getting weaker and more tired, getting sick more frequently. And then it got to where I could hardly even get up and down the stairs. I was experiencing chronic fatigue and I broke out into these rashes that literally covered my entire body for 2.5 years. No one could really figure out what was going on. And I just kept getting more and more sick. And I was seeing specialists all over, trying to figure out what was wrong with me. At this time, I didn't really know much about natural health, nutrition, holistic wellness. I was just kind of in the conventional medical model, taking the steroids and the pills, and my blood work had come back pretty normal, so they couldn't really figure out what was wrong. But literally I had oozy, itchy rashes like covering my entire body, where I had to pack my body full of ice in the evening to fall asleep, and eventually developed a systemic infection that led me to going on disability from my job as a physical therapist. And granted, this is, I am in my late 20s, not even 30 yet. So very young. And I got to the point where I thought, like, doctors kept giving me antibiotics, and they were worried that the infection would get into my bloodstream. And I thought I was dying. I was really, really at that point of like, okay, I think this is it. And by the grace of God, I took 4 rounds of antibiotics in a month and a half. The infection kept coming back. I had pus all in my mouth and throat, couldn't swallow, couldn't hardly eat. So this was a pretty intense experience. And I found this article. I was researching, and found this article called Natural Solutions to Drug-Resistant Infections. And it caught my eye, and I thought, maybe I have a drug-resistant infection. And it talked about wild Mediterranean oregano oil and how it was, healing people with malaria and different, chronically very, very severe illnesses. So I thought I would try it. It's like $20. And I, bought it online, and within a few days, the infection went away. And for the first time in years, I got some relief from the pain and itching in my skin. And so that really was the portal to opening me up to natural healing. And I thought, what is it? What do I not know? What else do I not know, about this? And so that really became this entry point into studying natural healing and nutrition. And I started seeing more alternative and holistic type practitioners, and that over time started to gradually heal. I started to get some answers. I was full of toxins, had lots of infections, and a poor ability to really clear toxins from my system. So I started to get more answers, started to change my diet, slow down my life a little bit. I was that type A overachieving, hardcore athlete and academic. And I realized that also was part of the puzzle here of learning to slow down. Mm-hmm. And then, so for 8 years, I really focused on healing my body like it was a full-time job. I was able to go back to physical therapy after a while and start working again, but it really opened up my passion into natural healing, and started a nutrition lifestyle company with my husband, and helping people heal their bodies through nutrition and lifestyle changes. And, it was a slow and gradual process. And I started, I was getting better gradually. And then it was almost to the point where I felt, okay, I think I'm almost ready to, start a family. I had a few lingering symptoms, but I was like, I'm doing pretty well, got my strength back. Mm-hmm. This is 8 years later. And then I was diagnosed with breast cancer.
Oh my goodness.
Yeah. And so that was this was a few years ago. So this was like, what am I missing? What am I not getting? Because I was really, dialed in my diet, lifestyle. I started meditating. I was really, spent hundreds of thousands of dollars on healers and treatments, natural remedies. You couldn't find somebody more committed to their healing. And it was like a full-time job, and I wasn't really living. I was just trying to get better and feel better. And then the cancer diagnosis came. And so I had to step back and go, what am I not getting? And I really, I share this in my book. I had to step back, and I found the mass in my breast right before we had planned this epic trip to Italy where we were going to start our family. So it was this tragic, oh my gosh, why is this happening to me?
Of course.
And then, and so, in the middle of the night at 3 a.m., I'm tears coming down my face going, hey, God, what do you want me to do? Because I knew that conventional chemotherapy and radiation was not going to be my path. I just didn't know what I was going to do. And, I heard this, I call it the divine whisper that said, if you're going to survive, you're going to have to learn to listen to your heart. And I just felt this immediate peace. And then I started to kind of panic because I thought, I don't know how to do that. I really don't know how. I don't know, maybe so many of the listeners and people and my clients that I work with, we're really stuck in our heads so much of the time. And, my immediate reaction to a challenge would be to research it, to try to figure it out, to strategize. And this was like, no, Brenda, it's time for you to really go within and listen and allow your heart to guide you. And so I knew there was a level of emotional and spiritual, healing that needed to take place. And so I committed at that point to learn to listen to my heart. And over the next few years, I had a pretty interesting and incredible journey through healing holistically and wholeheartedly, I should say, from cancer. And it really became the catalyst for me to live an even more extraordinary life. Now I can say that I can access joy and just living a life of purpose and wholeheartedness that I'd never experienced before cancer. And so now that's really why I kind of quit physical therapy, and I'm focusing on helping women, especially women wellness professionals, to truly heal and thrive so that they can give their gifts fully to the world. So that's kind of my story in a nutshell.
And are you now cancer free?
Yeah, so I'm doing great, and I'm doing awesome. And that's really where my focus is now, is helping women to heal and thrive and connect more fully to their hearts.
And quick question on, so you're diagnosed with cancer. You did not do traditional cancer treatments?
I did a sort of a mix. I didn't do traditional chemotherapy and radiation, but I did do surgery. So I went to a couple different clinics in the United States that focus on holistic and alternative cancer treatments. And so I did, it was a pretty wild ride. So we spent our entire life savings and did this treatment, but then I also had a mastectomy.
Okay.
So I did sort of a combination.
Yeah, because I just don't want to give the listeners the impression that you don't have to go through traditional medicine when you have a very serious diagnosis as cancer.
Mm-hmm.
And that, sometimes that is the route that one needs to take. And like you said, combining it with other holistic treatments, I think, is perfectly reasonable, but I don't want people to think that we're saying no, shun traditional treatments.
Exactly. And, for me, this is what I do know to be true is that, a decision made out of fear is never the highest, best choice. So when I work with women or I work with people on their healing journey, it's like learning how to really access the heart to be able to tune into that guidance to make decisions. So yes, get the tests and get the information from doctors and healers, and then trust your own heart to lead and guide you down that path. And that might look like conventional therapy for some people, and that might look like alternative therapy for others, and that might look like a combination. Mm-hmm. So it's really, definitely not shunning conventional medicine, but I knew for me in my heart that in this particular moment, chemotherapy and radiation wasn't going to be my choice, that I was going to do a combination. And it really does differ for each person. And that's the thing is, oftentimes we get scared into, doing things because someone else tells us that we have to do this or we have to do that. And, my recommendation is to take the information, but also really listen within and then let your heart guide your journey as well.
Right. Right. Yeah.
That's an important piece.
Yeah. And I think in combination with your physicians and and other practitioners that you're working with as well.
Yes, it's important to have an amazing support team.
Yeah.
To guide you.
Yeah, exactly. Exactly. Yeah. Yeah. I just don't want people to think that we're saying, no, don't listen to your doctors.
Of course. No. Yeah. And yeah, work with people on your support team that you feel good about, that you feel supports you fully and is in alignment with your values. I definitely navigating this path, I definitely had practitioners that, were trying to force me into something, or I just had a gut feeling that didn't feel good. And so to really follow that and find, doctors that are really on board with you and are listening to what your desires are, because they exist.
Yeah.
They exist for sure.
Of course. Yes, of course. Of course. Okay. So you've obviously gone through a lot over a full decade plus, it sounds like, of your life. So let's talk about kind of what you're doing now and how you're helping other, like you said, mainly women, kind of navigate through healing process.
Yeah. So I, like you mentioned earlier, like Karen mentioned earlier, that I felt really called to write a book. And so this book really is my love letter to all women, and it's applicable to men as well. But, it's really all the information I wish I would have had 10 years ago to really truly to heal and to really thrive. Because I spent 8 years really focusing on the physical aspect of healing. And I think that's where we're naturally inclined to, as sort of these physical beings, is that we're like, okay, nutrition, lifestyle, medication, the various things, focusing on our physical body. But what I've come to find out that, really looking at ourselves holistically, taking into account our mental and emotional and spiritual bodies, so to speak, and healing on those levels are equally as important as the physical. And then this sort of heart-centered approach of really learning to get out of the head and allowing the heart to leave. So that is where I call it like this wholehearted healing, or this wholehearted living approach. And so that's what I share in my book, along with my story. And I did research on, who were these men and women that were not only healing from catastrophic illness, but that were really thriving and using that illness as an opportunity to create an even more extraordinary life. And what did they all have in common? And so that's really how I, navigated my journey, and also, taking that research into consideration, really came up with these 9 wholehearted healing essentials. And I share that in my book, and that's really sort of the framework I use when I work one-on-one coaching with women. And then I also do, create and curate experiences, women's circles, and workshops and things to help women to have an experience of some of these things. So that's kind of what I'm up to now.
And can you share with us what your wholehearted healing 9 essentials are? And on that note, we're going to take a quick break to hear from our sponsor and be right back with Brenda's answers.
Let's talk about something important: patients and their outcomes. If you love to nerd out on this kind of talk like I do, the best industry event around outcomes management is happening from October 23rd to the 25th, and it's the Clinical Outcomes Summit. It's hosted by Photo, but it's not just for Photo clients. It's a gathering of everyone who believes in the power of outcomes management to drive change for patients, clinicians, practices, and payers. And the best part, Healthy, Wealthy, and Smart podcast listeners get a steep discount on the registration. The full summit pass is only $150. At that rate, go ahead and bring your entire team. Go to www.outcomesnerd.com and use the discount code Litzy. That's Litzy. Hope to see you there.
The first one is taking responsibility for your health and your life. And that really just kind of comes down to so many of us, we kind of rely on other people, maybe it's even relying on a doctor, or relying on, other people to tell us what to do or to have authority over our life and our health. And this really is just taking your life and your health in your own hands, stepping away from that victim mentality and really taking ownership of everything that's ever happened in your life, and taking responsibility for you right now so that you can be in the driver's seat of your life and what happens moving forward. And so the number 2 is creating a vision. And this is really, I have a mentor that always said it's better to be pulled by your vision than pushed by your problems. And so there's a lot of research that has come out in the realm of quantum physics and the power of imagination, of using our mind and elevated emotional states to actually change, to affect us on the level of our DNA. And so I really got fascinated with the work of, like Dr. Joe Dispenza and Greg Braden, and really tapping and honing in the power of imagination and vision when it comes to healing. So that is, something I really work with people to do, is like, what is it that we want to create? And then when we tune into that and imagine and tap into that elevated emotional state, that really helps to begin to pull that event towards us, whether that's healing or creating more of what we want in our life. Right. Number 3 is thoughts and beliefs. So just learning to manage our mind and harness the power of our thinking mind to create healing, and really looking at beliefs, because our underlying beliefs can be something that is really in alignment with our vision and what we want to create, or it can be subtly sabotaging if we don't really believe we're worthy of healing, or we have beliefs that are contrary to what it is that we really want. So that's a piece I think that often a lot of people overlook. And number 3 is feel your feelings. And so that is sort of tapping into that emotional part of healing, which I feel like there's a lot of energy that we deplete and waste because we are dealing with a low to moderate level of anxiety and stress a lot of the times. And that has a really huge impact on our physiology. So there's that whole element. I can dive into that more, but that's number 4. Number 5 is nutrition. So, of course. Yeah, really looking at what we're putting into our bodies, the quality of food. And not just what we eat, but how well we're able to digest and absorb and assimilate that food. I think it's where we are for.
Number 6
is live to thrive. And so in this essential, I really dive into lifestyle factors. So this is where exercise and movement and connecting with nature and getting sunshine and play and these different how we go about living our life on a day-to-day. And then the next one is connection and relationships. So really looking at the quality of our relationships. And I've found that in our relationships, that's where a lot of people can experience a lot of emotional drain.
Yeah, for sure.
And we know that how our emotional state, negative, quote unquote, depleting emotions affect our physiology. So really looking at the quality of our relationships and this piece around authentic connection. And I love this topic because this was actually a huge blind spot for me in my own life, is really learning what true connection really was, which is, the ability to be this sense of feeling connected energetically and being able to be seen, heard, and valued, and deriving strength and sustenance from the relationship. And, there's so much research on the impact of chronic loneliness. We're so disconnected. We're connected very much with technology, but there's so much loneliness. I think it was one study was talking about how chronic loneliness is equivalent to smoking like several cigarettes a day, and the impact that has over time on our body of not being connected with one another in a deep and meaningful way. So that is a really incredible piece to look at. And then we have self-love and self-care. So love yourself. And that really can encompass a lot of different things and can be an even bigger conversation. But really, I found underneath it all is really healing and thriving is all about truly falling in love with who you are and loving your life. And how does one do that? And then finally, trust and surrender. So I found that, of all the people that I researched, they all spoke about elements of really having this higher power that they were trusting, source, God, trusting within themselves, and surrendering the outcome of really learning to trust in a power bigger and greater than them to guide them on their path. And so that is the last one, is learning to trust and surrender.
I mean, that's a lot.
Yeah.
That's a lot. But if you think about it and break those down, that's what, as human beings, kind of what we need. So it seems like, oh my gosh, this is so daunting. This is so much work. This is going to be work. But if you take each one individually and break them down, I mean, it's pretty simple. It's what we all need to be happy and healthy and live our lives. So I get it. I'm on board.
Yeah, exactly. And, like I said, the intention really was to create this holistic healing living roadmap. So it's like, I wanted to, I've got all of this information downloaded and experienced in my life over the decade. And I got the little bits of information here. Oh, you need to learn about nutrition. Oh, okay, great. I will focus on that for many years. Oh, okay. I need to understand how my emotions impact my health. Okay. And so I got this information from different books or different teachers. Then I realized really, it's really about integrating all of these things. And they're all important to really living your best and most full life. And it takes all of those things to some capacity to really, really live and thrive. And it doesn't, like you said, you don't dive in and try to do them all at once.
Right.
But you start to, you focus on one thing and you begin to implement that. And that's why coaching is really amazing. It's like, I had so many coaches and mentors and teachers that helped me begin to integrate all of these pieces. And so it's helpful to, yes, my book is a good resource, but it's also helpful to have, someone that can see your blind spots and can see, hey, let's dive into, there's this emotional piece that you have held on to all these emotions from the past, and that's taking up a lot of energy and negatively affecting your body, but I didn't really see that. And so let's work through that together. So there's a lot of things that can be helped when you have someone to help you move through some of these things together.
Sure. And how has your training as a physical therapist, how does that play into the role that you're doing now with coaching? Because I know there are a lot of physical therapists who might be looking for non-clinical roles or non-traditional roles. So how has your training helped prepare you for what you're doing now?
How has my physical therapy training helped me for what I'm doing now?
Mm-hmm.
Yeah, well, I think, and, I actually had the really beautiful experience recently of going back and doing some physical therapy part-time.
Nice.
And so I've been able to kind of go from both directions and see the difference, how my training up until this point with all of this work has made me an even different physical therapist, how I interact. So from that perspective, and I think there's a lot of value for physical therapists and any healers or practitioners to interact and address the patient or the client from this holistic perspective, knowing that coming in, this person with chronic pain or this ailment there's many pieces, generally speaking, especially if it's a chronic issue, that it's more than just the physical aspect. Oftentimes, that there's an emotional piece, and that there is a mental piece, perhaps. And so, being able to relate to that person in their wholeness can help me be a better overall practitioner, to be able to offer some insights or how to relate to that person. And help them, experience a greater outcome.
Yeah, absolutely. And, it's that shift from a strictly biomedical to a biopsychosocial framework of treatment, which we talk about all the time on this podcast. I'm sure people are sick and tired of me saying it, but that is the way things should be in healthcare. So I will keep saying it many, many times. Now, before we finish up, is there anything that maybe we didn't touch on that you're like, oh, wait, I really want the listeners to know this?
I think really a piece that I think is really helpful, especially for practitioners, and I don't know much if we'll have time to go into this, but I am a HeartMath certified coach, and really we look a lot about energy management. And so we waste a lot of energy in the domain of emotions and negative and repetitive thoughts. And that affects our physical abilities and our physiology. And so really learning to manage our energy. And we do that through being able to get into a coherent state. So getting our heart, mind, and emotion in energetic alignment through slowing down the breath and experiencing elevated emotional states like love and gratitude, can actually get the heart into a smooth, coherent rhythm, which impacts the way that the rest of the body feels and how it can heal. And so I think if we learn some techniques as practitioners to help manage energy, we can improve outcomes for our patients and our clients. So this is sort of that combining of going beyond the physical, and that HeartMath has some really incredible tools. So you can check them out at HeartMath.org. I think it's a really great tool for a lot of practitioners. So I just wanted to throw that out.
Awesome.
So I think that
thank you.
has helped. Yeah, that's helped me a lot in my own coaching and with physical therapy.
Great. And we'll have all of that info at the show notes over at podcast.healthywealthysmart.com. So if people want to learn more about heartmath.org, they can just go click on it and you're there. So thank you for sharing that. Yeah. And now the one question I ask everyone is, knowing where you are now in your life and in your career, what advice would you give to yourself as a new grad right out of PT school?
Right out of PT school. So I would definitely, what I wish I would know now is really learning how to listen and lead from my heart. I feel like I got myself into a position where I was burnt out, running ragged, just trying to do the best I can as a new grad. And I missed a lot of the cues, internally of, hey, slow down. Hey, these other aspects of your life are important too. And, I think that was really the catalyst for me to start to get burnt out and sick. And so really to slow down and really listen to my heart is what I would tell myself.
Great advice. And burnout is real. This year at the Women in PT Summit in Portland, we have a whole panel on burnout.
Oh, really?
That I'm really looking forward to listening to, because I am not part of this panel. I am not part of the creation of it. It was sort of pitched to us, and I'm really excited to hear what the women on that panel have to say. Because it's a thing, and I think it's happening more and more with newer grads, because they're trying to work more and more. They've got student debt out the
yes,
you know what.
Yep.
So I feel like it's a real thing, and like you said, just to take a moment to slow down and focus on other parts of your life is something that can help. So thank you for that. And now, where can people find you if they have questions? Where can they get your book?
Yes. So you can find me. I'm in the process of creating, readjusting my website. So right now you can really connect with me by emailing me at risetoradiance@gmail.com. So that's RISETO radiance@gmail.com. And then I'd also love if any of this resonated with you, if you're a woman that is dealing with burnout, exhaustion. I love working with wellness professionals. If you're interested in some of these HeartMath tools that I use, I'd love to hop on the phone, and I'm happy to offer your listeners a complimentary 45-minute consult. So,
whoa, that's awesome.
Yeah. So if you'd like to take advantage of that. And you can go to www.BrendaWalding.com, and that is my calendar link. And so you would just set up a time to chat with me.
Perfect.
And I love hearing your stories and hearing where you're at and what you need the most support with. So happy to do that. And then my book is coming out in hard copy the end of this year, but you can find it on Amazon.
Perfect. And you'll give me all the links. I'll put all the links up on the podcast website under this episode, so that way people can get to you, they can chat with you. And thank you so much for offering a session for everyone. That's so nice.
Yes, awesome. I look forward to connecting with some of you.
Great. And again, Brenda, thank you for coming on and sharing your really incredible story. And we are all very happy that you are today healthy and happy and moving forward. So thank you so much.
Thank you, Karen. I enjoyed being here. So thank you for the opportunity.
Of course. And everyone, thank you so much for listening. Have a great couple of days and stay healthy, wealthy, and smart. Well, I want to thank Dr. Walding for sharing her story and her path to wellness, and for her offer, incredibly generous 45-minute consult with her. And again, you can find all of that at podcast.healthywealthysmart.com. And of course, I also want to thank Net Health for sponsoring today's episode. So again, if you want to go to the Outcome Summit in Knoxville, Tennessee, October 25th to the 27th, then go to www.outcomesnerd.com. Use the discount code Litzy, that's Litzy, for a very, very steep discount in the price. It's only $150. So if outcomes are important for you to drive your business, to bring in more patients, to have a happier staff, then definitely check out the Outcome Summit in Knoxville, Tennessee, October 23rd to the 25th.
Thank you for listening, and please subscribe to the podcast at podcast.healthywealthysmart.com. And don't forget to follow us on social media.